Myself, Dr. Suvanya Mahajan, resident, Department of Radiodiagnosis, ESCOMS, Hospital, Jammu. My topic for today is dual energy CT in clinical practice beyond renal stone characterization. Introduction. Dual energy CT is an advanced CT technique that uses two different X-ray energy spectra acquired either simultaneously or near simultaneously. This allows tissues and materials to be differentiated based on their energy-dependent attenuation properties. It is based on the principle that low and high energy data sets exploit the differences in photoelectric absorption and Compton scatter. It enables material decomposition like iodine, calcium, uric acid, fat, and hemorrhage to be separated and quantified. It creates novel image types like iodine map, virtual non-contrast images, monoenergetic images, and effective atomic number maps. Initially established for uric stone characterization, like to differentiate urate versus calcium oxalate stones, which was clinically relevant because uric acid stones can be dissolved medically, while calcium stones often require intervention. There are many uses of dual energy CT beyond stone characterization, and those are in oncology, vascular imaging, musculoskeletal imaging, emergency and trauma cases, liver, abdominal imaging. Objectives of my study are to study application of dual energy CT beyond unary stone characterization, to evaluate uses of dual energy CT in oncology, vascular, MSK, and emergency imaging. Methodology. This was a prospective observational study conducted over 7 months with 24 cases divided into oncology, trauma, MSK, and vascular subgroups. We used Simon dual energy CT protocols including iodine maps, virtual non-contrast, and Z maps. Discussion and results. In oncology, dual energy CT improves lesion conspicuity by separating iodine signal from background tissue. Iodine maps also allow quantitative assessment of tumor perfusion, its vascularity, and treatment response. Monoenergetic images enhance contrast to noise ratio, especially in hypovascular lesions. Dual energy CT also differentiate recurrent tumor from post-treatment changes. Pulmonary embolism detection is enhanced with dual energy iodine perfusion maps. Diagnostic confidence in subtle perfusion defects, particularly in subsegmental vessels, is also improved. Dual energy CT aids plaque characterization by differentiating calcified versus non-calcified components. It helps to reduce blooming artifacts from stent and heavy calcification. Dual energy CT identifies monosodium urate crystals with high sensitivity. It provides color-coded maps for tophi distribution, which is useful in treatment monitoring. Detection of marrow edema is also possible with dual energy CT. In emergency imaging, dual energy CT is helpful in differentiating hemorrhage from iodine extravasation. Virtual non-contrast images reduce need for true non-enhanced phase, which reduces dose and time also. Detection of subtle vascular injuries in polytrauma is easy with dual energy CT. It is also useful in bowel ischemia and acute aortic syndromes. There are some pitfalls and limitations also. Image noise at low KEV reconstructions may reduce quality in obese patients. Vendor-specific algorithms create variability in results. Learning curve for interpretation and post-processing, non-universal availability. In our study, dual energy CT demonstrated clear benefit across multiple clinical applications. Neoplastic lesion detection improved by 25%. Iodine maps also helped in gaining diagnostic confidence. Sensitivity in gout crystal detection was 90%. Marrow edema detection was consistent with MRI correlation, enabling faster diagnosis. Dual energy iodine maps improved diagnostic confidence in subtle pulmonary embolism cases. Virtual non-contrast protocols helped in reducing exposure while maintaining diagnostic image quality. Overall, dual energy CT enhanced diagnostic confidence supported treatment decisions, and reduced unnecessary imaging. Our study shows comparable results to available literature. This was a case of fracture of femur neck. It is a post-processed color-coded bone marrow map superimposed on calcium image. The highlighted region represents marrow edema here. This dual energy CT image shows a urate deposit along Achilles tendon. The color-coded map highlights monosodium urate crystals, which is very useful in diagnosing and monitoring gout. Here we can see an axial dual energy CT image demonstrating a parenchymal perfusion defect caused by a thrombus. The iodine map helps us identify areas with reduced perfusion more confidently than standard CT. The image compare conventional CT on the left with dual energy CT on the right. Dual energy CT clearly demonstrates the parenchymal hemorrhage, helping in differentiating and confirmation of bleeding sites. This image shows hypervascular hepatic metastasis from clear cell renal carcinoma. The dual energy technique improves visualization of contrast uptake, highlighting subtle lesions that might be missed on conventional CT. In conclusion, dual energy CT is no longer limited to stone characterization. It provides both functional and anatomical information across multiple systems, improve diagnostic confidence, and reduce radiation exposure with BNC protocols. There are some key references. Thank you.